How you doing, Dr. Lowe?
Khaled, good to see you, man. It's been a while.
Yeah, it has been a while. Oh, a week. You've just been doing so much. No, but yeah, so I got a lot of
Hey, COVID-19?
yeah. So a lot of viewer questions. I'm gonna get that right at them because I know you're a busy doctor. Okay. Once the stay-at-home order is over on May 20th, is Mississauga going to go back to red zone, gray zone, or is it going to be extended?
You know, it's really tough to tell at this point in time. There's going to be a lot of things we got to be looking at. We got to make sure that our ICUs are coming under control. Right now, they're, as you know, they're really severe, both in Mississauga at Trillium, but also up in Brampton and William. Most of our hospitals here have just they're holding their own, but they've been overwhelmed by this surge of hospitalizations and intensive care demand that's come through. They're continuing to transfer patients all over the province. You might be getting transferred as far away as Windsor, St. Thomas. So it's pretty serious. So we got to keep an eye on the hospitals. We also got to keep an eye on our vaccination coverage rates, which have really hit stride. We're 600,000 doses almost delivered now in the region of Peel as of yesterday. We're vaccinating at about 1% of our eligible population every single day. So we were at 40% last week. So if you do the math, and to get to 75%, you're looking at 35-ish days if we manage to keep firing on all cylinders. So hopefully the vaccine coverage starts to kick in. Hopefully we start to see our hospitals clear out, and hopefully our case trends will start to go down so that we can really start to loosen this and just get out of this, hopefully for good.
So you're saying that in 35 days, you think all of Peel that will be vaccinated, at least 75% for herd immunity?
It'd be 75% first doses. So herd immunity is with 2 doses, obviously, but we know from Israel and from the UK and certainly from certain US states that once you get to 75% first doses, you start to see changes in hospitalization patterns, you start to see changes in transmission patterns that then allow you to start reopening. A great example is, for example, a lot of the southern US states where a combination of better weather and more outdoors plus immunization has really helped to change the tide there. Even New York City, for example, is looking at starting to loosen a significant slate of restrictions as of May 19th. Because our vaccination rollout started a little bit later than everyone else is, we're going to take a little bit just to get to the same point, but we will get there, and we are definitely doing everything we can to keep putting people through mass vax and getting vaccinated in our community.
Awesome. All my friends in Mississauga South are saying, why isn't my postal code part of the hotspot? When do you think Mississauga will become one big hotspot?
That's a great question, because honestly, we as the region of Peel at Peel Public Health, we've been trying to work with our provincial partners to tell them that to share with them that, for communications purposes, for booking purposes, easier to just say if you live in Peel and you're 18 plus, you get vaccinated. As you know, the province sets the hotspots. We're hoping that they're going to revisit the hotspots, and even if the hotspots aren't revisited, we're actively looking at ways to try to make sure that those people who have been in non-hotspot regions can also access the protection as well.
Okay. 18 plus pop-up vaccination clinics, are they still happening now?
So our pop-ups and our mobile are a little bit different than those in Toronto, right? I mean, I think in Toronto, kind of like, it's almost a bit, it's a bit significant, just the lines and the people waiting outside all night and stuff like that. We've really tried to avoid that here in Peel. And in general, because 85% of our community is a hotspot, and because now we've moved to 18 plus to book, that means all of our residents can now access our vaccination system, both the hospital as well as the community vaccination sites. So there's 120,000, 150,000 appointments right there every week that people can now access. I really encourage everyone to do that. We also have booking and transport supports for some of the communities that have barriers to get to those. We've got TransHelp, we've got community agencies and ambassadors that are trying to get the word out to push people to mass vaccination clinics. So our pop-ups, they're becoming less and less, I think, for the general community, and they're becoming more focused on the people who really can't get to our vaccination system. So people who, by virtue of where they work or by virtue of, either linguistic or cultural barriers, may need a little bit more focus to have a mobile thing there. So my advice, if you're 18 plus, you live in the region of Peel, especially if you live in a hotspot right now, don't wait for a pop-up to show up in your backyard. You can book online right now and get vaccinated. There are appointments available.
Awesome. Okay, I'm throwing these questions at you fast. I know that Amazon today had a pop-up. Are there any other companies or workplaces that are on slate for a pop-up?
Absolutely. These pop-ups are through a private-public partnership that's being directed by the Ministry of Health. And so Amazon, Maple Leaf, Maple Lodge, those are the first three. We know that Amazon's went this week. We had Maple Leaf and Maple Lodge go as of last week. And I understand that there are a number of employers that are coming in a second phase that have been working with the province to set up. And these are not just, they will get the employees in the sites, but they're also putting out community clinics as well, or supporting community clinics, some of those pop-up clinics that I mentioned that are getting to the hard to reach. So I think our ministry partners are on the verge of approving a few additional sites, and I'm hopeful their announcement will come soon.
Awesome. Health Canada approved the Pfizer for 12 and up. Do you think kids will be vaccinated before the school year in Peel in September?
That's actively on the mind for everyone. And there is actually a pediatric table that has been set up, I believe, at the provincial level to look at that question. And we'll wait and see what they come up with as a plan for kids 12 through 18, right? Because we do have that 16 to 18 group that's also approved that we need to figure out what we're going to do about.
Do you think kids will have to get vaccinated before September to go back to school?
I think the reality is, we've seen how anyone who remains unvaccinated remains a risk of transmission. And certainly we know that there are people who have severe outcomes no matter what the age is. Certainly the recent passing of a 13-year-old in Brampton, which was very, very tragic, really reminds us that this disease, you never know, especially because it's brand new, how your body's going to react to it. So I think, to the extent that we can really try to get as many people in our community protected, including those that might be children and youth, I'm sure that's something the pediatric table will be looking at.
Okay. J&J vaccine, is that going to be distributed in Peel?
Yeah, so we understand that the province is going to be receiving an allocation of J&J at some point. We're just waiting for confirmation as to how that vaccine will be deployed, like which specific population they would like it targeted at, and then also confirmation on the final numbers, and then we'll be able to share more details on how that gets added to our arsenal.
Awesome. And here's a question I get from mums all over the place. They all say, can I get my second vaccine sooner than 4 months?
So right now, the province has directed the second dose interval of 4 months. They have very specific exemptions. So it's usually people with solid organ tumors or solid organ transplant, blood tumors, those people that need to reduce the interval, as well as First Nations on reserve and long-term care home residents. Those are the limited exceptions to the 4-month dosing at this point in time. But of course, with more supply that is coming in, it will remain to be seen whether it gets maintained at 4 months, or if we manage to get through first doses to a large swathe of the population, whether they open it up sooner. So I guess the answer to that is to stay tuned.
Stay tuned, okay. When do you think outdoor amenities like golf, tennis, basketball will open up? Do you think that'll open up before May 20th?
Yeah, again, it's one of those things. I think, the province was really trying to send, I think, a strong message in closing those amenities. And I think to the extent that I think for the extent that we can try to encourage outdoor activities, I'm certainly hopeful that, there's this ongoing discussion, truly trying to revisit how best to actually ensure that people can still access and enjoy the outdoors, but also just try not to confuse the message. Again, everyone, we are in a severe third wave here in the region of Peel. Our hospitals are transferring, hundreds of patients out every day sometimes. And we just really need to make sure we're limiting our interaction and contacts, trying to stay home and trying to make sure that we're starting to see a decrease, hopefully that continues, because all of us want to see it continue. And then as it finally gets out of this third wave, that our vaccine coverage hopefully gets us out of this thing for good.
Okay. Do you think the kids will go back to school before the end of the school year this year? Or this school year?
It's one of those things. We know that the best place for kids to be in is in school, but we know that the measures, especially at the high levels of transmission in the community we have right now, really limit the ability to ensure the safety of in-person learning. Like they're very good at certain levels, but every precaution has a limit, right? And so I think it'll all depend where the trends go, and the hope is that we will be able to get to some point where community levels of transmission mean that the measures to keep students safe in school would work, and that we would be able to return. So nothing confirmed yet, but we continue to monitor.
Okay. And are you starting to see a positive impact in regards to Peel Public Health closing down workplaces?
Yeah, so we're now about a week and a half into that policy. we have seen, at least just from the places that we've closed down, that it has helped us get ahead of the virus in those outbreak investigations. We know that there's an impact on businesses, and we're really grateful that they've stepped up, because I think their work is keeping not only their workforce safe, but also our community safe as we try to get this under control. And then the whole effect on our community in aggregate, well, we're going to see where it lands probably through the end of this week and into next, just to see how that contributes to the overall trends.
Okay. And another question we got here. When do you think the pandemic will be over?
Well, I think it depends on what your definition of over is, right? I mean, I think a lot of people are, we've been now through 3 waves, and honestly, no one wants it to be over more than me. I can say that with absolute confidence and certainty. But I think the big thing is it's not going to be like a date where it's like, this is the day that the pandemic ended. It's going to be a gradual exit. We're going to get to 75% first dose coverage. We'll start pumping up to, 75% 2-dose coverage over months. And during those times, we'll see changes in our patterns where we will start to loosen different measures and restrictions. Honestly, the last things to go will probably be distancing, masking, and capacity limits, because those will always be in some form or another until we can really get things under control. And then it may remain to be seen if COVID-19 becomes something where hospitalizations and deaths are now being prevented, but it's just a matter of people getting, sniffles, cold, whatever, then, that will be a point where we finally sort of come through long enough that we're starting to see a difference in the way we would treat that disease versus what we have right now.
Okay. And here's kind of a fun question. I'll end with this one. My friend is having a wedding in April of 2022, and he's a bit cheap, so he wants to do a buffet. Do you think there'll be buffets in April of 2022?
That's a super fun question. I'm an optimist. I'm hopeful that by the fall, we're going to see something. If we continue, and this is where everyone needs to do their part. If you haven't been vaccinated yet, 18 plus in Peel hotspots, and hopefully we can get the rest of Peel opened up. But if you can get vaccinated, the faster you get vaccinated, the faster we get to that coverage. I know some people have questions, concerns. The way out of this is to get vaccinated. I can share that when I got vaccinated, it was basically like shot in the arm, felt like my arm got punched for a few days. Like it was all well and good. But then afterwards, you feel it's the best way to protect you, your family, and for us to get out of this all together if we all do our part. So if you want buffets in April 2022, if you want to get back to a life more ordinary in the fall, I think all of us stepping up, making sure that we're keeping each other safe and limiting contact now as we control the 3rd wave, and then start to get vaccinated so that we can get out of this with confidence. That's our way forward. And frankly speaking, you'll see me at a buffet sometime soon, hopefully, because goodness knows it's time to put food in for sure.
So Dr. Lowe, what you're saying is maybe a wedding by fall, buffet by April of 2022.
Absolutely. Well, what I'm saying is we don't know what it's going to look like, but honestly, if we do all our part now, the summer will start to look a little bit better, and hopefully the fall in 2022 will look a whole heck of a lot better than it does right now.
And Dr. Lowe, one last question. Where are you going to go on vacation once the pandemic is over?
It's really interesting. I've been thinking about that for a long time. My folks and my family, I have extended family in Malaysia, and it's been a long time I've been back there. And so it'd be great to go back and visit friends and family over there and just enjoy some good food. But either or, Malaysia always has a special part of my place, in my place in my heart. So that's always an easy answer for me. But I really hope everyone does our part. We'll all be able to take some vacations, eat up some buffets, and make sure to do so with confidence that we're vaccinated.
Awesome. Dr. Lowe, thank you so much. I know you have a crazy day. Have a great day.
Thanks for having me, Khaled. Take care.
Okay.